Hello dear student, welcome back in this anti-leprotic agent part. In this chapter we will see what is leprosy and what are the anti-leprotic agents. So first part we are going to see, that is, what is leprosy. Leprosy is a chronic disease which is to be caused by the Mycobacterium leprae. It is characterized with lesions on the skin and on the peripheral nerve, or peripheral nerves are being affected and the lesions are produced on the skin. So there are actually basically two types of the leprosies. First is a tuberculoid leprosy and second one is a lepromatous leprosy. In tuberculoid leprosy, in this, the skin and the peripheral nerves are involved, resulting in the motor and sensory changes in the affected area. It means that the skin, particularly the patch, is produced on the skin. It means skin is involved, as well as peripheral nerves means whatever the nerve supply in this area, it is affected. It means what? There is no sensation in this area. Sensory and motor changes are occurring in the affected area where which the infection of leprosy, particularly tuberculoid leprosy, it has been formed. So that area showing affected sensation, or we are calling there is no sensation, and sensation and motor changes are there in this area. So such type of leprosy, if the patch is developed, and the leprosy is called as tuberculoid leprosy. And the second one, that is the lepromatous leprosy, in which skin get thickened and edematous and painful nodular lesions are being produced or occur, which may becomes necrotic and ulcerative, and that releases the large number of mycobacteria. So in this way you can see that in the image the skin become thickened and edematous. So such type of epilepsy, in which again the skin is being affected but skin become thickened, as well as further results into a painless and nodular lesions, which may releases the which may become necrotic and ulcerative and releases the large number of mycobacteria. So such things will be happen in case of lepromatous leprosy. Next, the classification of the anti-leprotic agents. Now first we'll see the definition of anti-leprotic agents. The agents which are used in the treatment of leprosy are called as the anti-leprotic agents. Next thing is the classification of the drugs, or the classification of the anti-leprotic agents. So in that, first is a sulfone. Best example, that is DAPSONE. DAPSONE is an example of the sulfone. Next, thiosemicarbazone derivative. So thiosemicarbazone derivative example, thioacetazone. Next, phenazine derivative, clofazimine. It is an example for phenazine derivative. And other drug which exhibit the activity against the Mycobacterium leprae are long-acting sulfonamide, ethionamide, and antibiotic like rifampicins. So these are the drugs which has additional activity, long-acting sulfonamide, ethionamide, and the antibiotics like rifampicin. So these having an additional activity against the leprosy. So this drug again can be used in the treatment of leprosy. In that, first, now we are moving towards the drug, that is first DAPSONE. DAPSONE is also called as DDS. DDS stands for diamino diphenyl sulfone. DDS stands for diamino diphenyl sulfone. Now DAPSONE is a sulfone basically, because SO2 is there. It means what? It's a sulfone. Next, its chemical name, as far as the chemical name is concerned, so its chemical name is a 4,4-diamino diphenyl sulfone. That's why DDS came, diamino diphenyl sulfone. From this DDS came diamino diphenyl sulfone. Now the amino group of the sulfam oil SO2NH2, in that amino group of the sulfonamido is replaced with the para-amino phenyl group. Okay, para-amino phenyl group will be instead of NH2, else hence it will be a sulfone derivative, or maybe a sulfonamide, one of the sulfonamide. Now what the question arises, how in the chemical name 4,4- comes? So for this we have to give the separate numbering to this diamino diphenyl sulfone, or to the structure we have to give the sub numbering. So as far as the numbering is concerned, we have to start numbering with this 1, this will be 2, this will be 3, this will be 4, next 5, and next one will be the 6. This will be the way of numbering to this phenyl ring. Next, another phenyl ring is there, in that again we have to give the separate numbering. So in that we will use a 1 dash, 2 dash, then 3 dash, 4 dash, 5 dash, 6 dash. So in this way we will give the numbering so that you can see that the 2 amino group that we are calling diamino, 2 amino group, one is at the 4th position and second one is at the 4 dash position. That is why in the chemical name the naming are given as a naming is given as 4 dash. Naming is given as 4 dash, 4 and 4 dash diamino diphenyl sulfone. The amino group, definitely that's why the name become 4 dash diamino diphenyl sulfone. Now the physical properties of dapsones: it is a white, creamy white, odorless, light bitter crystalline powder and very slightly soluble in water. Next, it shows the diazotization reaction. So chemical property, diazotization reaction: dapsone when treated with the sodium nitrate in presence of hydrochloric acid, both the primary amino groups are getting converted into a diazo group. So you can see that this is the structure of a dapsone, which has a 2 primary amino group. This one is the first, this one is the second one amino group, primary amino group. So in presence of HCl and NaNO2, that is the proper chemical reagent used in the diazotization reaction. So in order to complete the diazotization reaction, these NaNO2 as well as NaNO2, sodium nitrate, and the HCl are the common ingredient. Temperature condition 2 to 10 degrees Celsius that we will use. So now you can see that at the end both these amino NH2 primary amino group got converted into diazo linkage. So that depends on the number of primary amino group, as there are 2 primary amino group in the dapsone. So both these amino group got converted into diazo linkage. So hence it get proved that the dapsone undergoing the diazotization reaction. Next, when dapsone is condensed with the cinnamaldehyde followed by the addition of sodium bisulfite, it gives the solapsone. So solapsone is being produced from the dapsone just by condensing with the cinnamaldehyde and followed by the addition of sodium bisulfite. So next, stability storage: it should be stored in tightly closed light resistance container used in the treatment of the leprosy, in both the form of leprosy in combination with the other rifampicin. Next, it has a suppressive action on the malarial parasite in the treatment of dermatitis herpetiformis and relapsing polychondritis. Polychondritis stand for the discoloration of the external ear or a pinna, in which the relapsing polychondritis stand for coloration, discoloration. So this will be the case. Inflammation and the red coloration or the discoloration of the external ear or a pinna is called as the relapsing polychondritis. So this may be again a skin disorder, and as is leprosy again concerned with the skin disorder, this dapsone can be used in the treatment of relapsing polychondritis. Again, it is used in the combination with the trimethoprim and pyrimethamine. It is used in the treatment of pneumonia. The pharmaceutical formulations are tablet. Dubronax is the brand for this dapsone. Next is the solapsone. Just we had seen solapsone is obtained from dapsone by condensing with the cinnamaldehyde. So basically this will be the structure of the solapsone. So solapsone is obtained from dapsone even. Now the color, as far as the physical properties: color white, odor odorless, taste slightly bitter, nature crystalline powder, very soluble in water. It is used in the stored in tightly closed light resistance container and uses in the treatment of leprosy. Next, thiambutosine. Physical properties: white, odorless, white, creamy white, odorless, then bitter crystalline powder, very soluble in water. Storage: it should be stored in tightly closed light resistance container, used in the treatment of leprosy and neuritis. Formulations are tablets. Ciba 1906 is the brand for thiambutosine. Next, clofazimine. Physical properties: color dark red, odorless, light bitter crystalline powder, insoluble in water, and it is stored in tightly closed light resistance container and used in the treatment of leprosy, as we are dealing with the anti-leprotic agent. Clofazimine, clofazine and lamipirine. Clofazine and lamipirine, these two are the brands for this clofazimine. Okay, so in this way we had finished these anti-leprotic agents. Thank you so much.